I'd like to take a moment to share with you my experience with a new technology that we've been using in the operatory. This is the iTero optical scanner from Cadent. We're going to optically take an impression of this tooth. You can see we have prepared tooth number 19 for a full crown, and we've skipped showing you the preparation sequence because that is not the focus of this presentation. We are placing the 00 cord into place. Now I'm removing the temporary material that the endodontist put in place after the root canal was accomplished. We're going to go ahead and build this tooth up in just a minute. I am placing the 2 cord on top of the 00 cord at this point, and a lot of dentists ask if I'm going to take an optical impression, do I still need to pack cord? And you do, because you're not able to see through tissue with the optical scanning device, so you do still need to clear the tissue. You could use a laser if you wanted to. In this case, we're going to use the standard 2 cord technique. That is Ultra Dense Ultra Etch that we have etched the inside of that molar with, and we're going to place some bonding agent. Placing the OptiBond on the inside of the tooth, we're going to use a little air to evaporate the acetone and then cure that with the UltraDent Ultralume LED light, which because of its shape fits into the back of the mouth very easily. Then we're going to go ahead and place our buildup material into that opening and cure it, and then we'll just need to go ahead and prepare that and shape it. So rather than having a flat tabletop, as you see here, we're going to go ahead and prepare that and make sure we have a nice, well-defined central groove so that our dental technician can put some anatomy into this restoration. We see a lot of flat tabletop preparations, and they just don't work when you're trying to make a restoration that looks like the adjacent teeth. After letting that sit in place, that top cord, for 8 to 10 minutes, we're going to pull that number 2 cord out, and I'm using the scanner, and you can see up on the screen on the computer monitor what I'm looking at as I'm going around and scanning this tooth. And so it takes 21 separate views. You can see it flashing as it captures the information. So we're going to get the prep tooth, the adjacent teeth, we're going to get the opposing tooth, and then even towards the end of it, we're going to have the patient bite together into centric, into maximum intercuspation, and we're going to take a picture of that too. That is the virtual bite registration. As a test on this case, we're going to also take a conventional impression with a polyvinyl siloxane impression material. So we're using the double arch tray from Clinician's Choice, and we'll put that into place. So we had the 2 cords in, we took out the top cord, did an optical impression, then a conventional one. There's a close-up of what that looks like, and the margins appear to be well represented on that impression. So we'll send both of these to the operatory, one of them digitally, and one of them the old school way, where we take the impression, drop it into a box, and send it to the technician. And here we are 2 weeks later, removing the temporary crown. I can see that we've got temporary material stuck to the tooth because we use Duralon most of the time. This is the Cavo Sonic Scaler. What a great way to get any temporary cement off of a tooth, but especially when you use something like Duralon or something much stronger, because maybe you had a temporary come off or you're worried about a short clinical crown. So we're trying in the PFM now that was fabricated with the standard impression, and so nothing special was done to this. We just sent it into the laboratory and asked them to make a crown for us. The impression itself was the bite registration material by having the patient bite down into the double arch tray. And we just want to see for ourselves what kind of fit difference we get between these two modalities. And here's the crown back with the Cadent impression. Because there was no conventional impression material used, where you can have 2.5% permanent deformation of the impression material, it should be more accurate with the Cadent impression. And furthermore, there's not a conventional model made where you have to mix plaster, stone, and water together to get a model. It's milled, and so there's no shrinkage of the stone. And so when you use this Cadent optical impression, by eliminating the actual impression material and the actual model material, you end up with something that's going to be more accurate because we don't have the distortion that we see. Impressions can expand, can bloat by 3% when they're soaked in disinfectant, as they should be before being sent to a laboratory. So the Cadent really eliminates most of this. The contacts are good on the Cadent crown. We're checking the occlusion. We got some nice heavy spots on the full cast gold crown behind it and the virgin teeth in front of it. and just a couple spots, one on a cuss tip, one that'll need just a tiniest bit of adjustment on an inclined plane, but the contacts are good. We shot a digital x-ray. The interproximal margins were closed, and we've got very nice occlusion on that as well. And that's what you would expect with this optical impression, where we're eliminating most of the air. And there's a post-op shot of the tooth in place. The shade's pretty darn close. It certainly matches better than the gold crown behind it. And so we proved to ourselves on this case at least that optical impressioning does work as a technology and can even beat out, do better than a conventional impression.